How you doing?
I'm good. I can see I'm cut off. Hang on, let me fix that. Is that better? That's
Yep, that's
better.
good. Yeah.
Okay.
So, how you doing? How's the day?
Um, it's busy, but I'm having an iftar dinner tonight, so I've been fasting.
Oh, have you? How's that going?
Well, I realized a couple of things about myself. The first one is I'm highly addicted to caffeine.
Oh yeah. Oh yeah. You're not even drinking caffeine. Oh yeah. Okay. Yeah.
So it was a very slow morning, and everyone will tell you that it was on a Zoom call with me from starting at 8. Even at the 10:30 call, I was still kind of yawning. So I don't mind giving up food for the day, but coffee, I should have got up before sundown and had a few coffees. That's what I should have done. Next time I'll
Well,
know.
well, good on you for doing it.
Well,
So
at least one day. I mean, of course, I'm not Muslim, I'm Catholic, but if we're having iftar dinner to in solidarity to do it one day, I think that's meaningful. It's not that easy. They do it for a month of Ramadan.
you're right. A lot of questions. Are you a vaccine expert yet? So, because I got a lot of vaccine questions for you.
I'm trying to stay current. I'm trying. I'm not a medical expert, but I'm doing all the reading as much as I can. So I get all the questions. I answer them all at council too. So
Okay. One of the questions we got was, are you having any progress in getting Mississauga as an entire hotspot rather than postal codes?
So that's an interesting question. And I think by the end of the week, we'll know more about that.
Okay.
So, we have, I think the recent number, there are 3 FSAs around the airport that really are only airport employees. So that doesn't really count because they can get vaccinated in their homes. So the way it works is there are 31 of 33 that are. So there's only a handful that aren't. And of those, our case rates and our hospitalization rates are higher than all the other FSAs around the province, other than at Peel and Toronto.
Okay.
They're higher. The ones who in Mississauga that aren't considered a hot zone, a hot spot, are higher than other places. Even than some other hotspots, but they're
So
not
you,
included. So we're not sure why, but we think we might hear something by the end of the week. So we're very hopeful because it does make sense, and then we can just open it up to 18 plus, right? To
yes.
register for their appointment throughout Peel, which was fantastic because all of Brampton is. There is one FSA in Khaled that is not, and only I think 3 plus what's around the airport in Mississauga that's not.
Okay.
So very
Uh,
interesting.
yeah, it is very interesting. So you think by the end of the week, all of Mississauga 18 plus? Okay. All right.
I'm hoping to hear.
Okay.
I'm hoping to
Uh,
hear something positive.
how about like people that work in hotspots neighborhoods? Can they get vaccinated in those areas?
Wow. So I believe, so certainly when you were a teacher
Yeah.
or special ed or related, an educator of any kind, it mattered only that you lived or worked in the hot spot. So if you're an essential worker, I think you can make a case. I would certainly if your workplace is in a hot spot, and you don't live in the hotspot, I would certainly if it were me, I would register under that postal code,
Okay.
right? And then you get there and they'll say, "Oh, but do you live here?" You say, "No, but I work there and I'm an essential worker," and I bet they're going to let you through.
Yeah, the more people we get vaccinated sooner,
That's
the
the
better.
point. That is the point. And I know they're very generous at all the mass vaccination sites about vaccinating whoever comes. You know,
True.
if you can give
Uh,
them a good reason to give you a vaccine, you'll get your vaccine.
good point. So, 18 plus pop-up vaccination sites. Have we seen the end of those because of the 18 plus in most of Mississauga and Brampton?
So our pop-up sites are a little bit different than the ones in the city of Toronto because we've seen those in some very vulnerable, high priority neighborhoods. Our pop-ups have been targeting marginalized and vulnerable communities. And largely they have been in cultural or places of religious worship, and that is true. Although there will be one on, I believe, Friday in Malton That is not. It'll be held at the Malton Community Center run by MNS.
Okay.
Malta Neighborhood Services. I believe that's this Friday. The others have been targeting people who are less likely to get vaccinated at a mass vaccination center. That's been the key. And of course, these groups stepped up. They assumed all liability and all costs and were very well organized. And those were the first few that we have seen. There are others planned that have not been announced, so I can't share them with you, but there will be others. Now, that said, Dr. Lowe preference is that we push the people through the central booking system through COVAX, or either online or call. So they have access to the Peel's 11 sites, 5 of them in Mississauga, or Trillium Health Partners is also operating their own registration. So either COVAX or Trillium Health Partners registration. We are now doing 15,000 a day, over 100,000 a week. And that's just because of supply of vaccines. So they're very efficient. And I have yet to meet anyone who has done anything but praise their experience. Everyone says it's a great experience. People come in, they're very happy. They're happy to be there. They know they're going to be vaccinated. They're going to be protecting themselves and their families and their loved ones and the people they work with. So it's a great experience. We make it as easy as possible. We've talked about this before. You're in and out in about 30, 40 minutes, depending. You get screened, you check in, you get a date for your next appointment, and then you line up for your vaccine. They send you to a station. You get your vaccine. They tell you what it is. You talk about it, any allergies, etc. And then you have to sit for 15 minutes and you're observed in case you have any adverse reactions. And then you're released, 30 to 40 minutes tops. It's a great experience. So our preference is that people go to the mass vaccination sites. And we have 5, and you all know where they are, 5220 here in Ontario, north of Derry, the International Centre, Paramount Fine Food Centre, Trillium Hospital, and of course UTM, that's also run by Trillium Health Partners. And I have yet to meet anyone who has a negative word to say about any of the sites. They are well operated. They're very efficient.
No, I agree. Everybody I talked to, they're like, that was fast. That was great.
And well organized.
Yeah, and well organized for sure. And I got the AZ, so I don't know. I'm glad I got it, but I mean, at the end of the day, now all this confusion about second dose. Am I going to get a Pfizer or Moderna? Or anyways, we'll figure. I mean, that's another conversation. But
right, is that where you want to go? Because we can talk about that.
Oh, yeah, we can definitely talk about that.
Just briefly.
Yeah.
So there, initially we were told there was no cocktails of vaccines. Whatever you got is what you would get for your second dose as well, to top it up for full strength. And now there's some studies being done that if you received an mRNA vaccine, so Pfizer, Moderna, or the mRNAs, would you get a AstraZeneca or a J&J, for instance, as a second dose, just to give you complete coverage and protection.
Yeah.
So I think there's no answer to that yet, but that is being studied. Now, J&J is interesting. It was just approved, so it hasn't been out yet. And interestingly, also, it's a 1 dose. So whether you would get a top-up of a J&J, I don't know the answer to that. But I'm following it just like everyone else, because initially it was, okay, you got the AstraZeneca, the AZ, your second dose will be AZ, and now they're saying, well, maybe we should mix it up just to give everybody full protection. So I know that is being studied.
Yep, I got it and I don't regret it. So
absolutely.
16 plus vaccinations. Are we going to see that anytime soon? I know one place in Halton actually had a 16 plus.
Pop up. Interesting. Yeah. It's interesting how there are regions that are kind of rogue. And doing what they want. We've been pretty much we follow the rules. We're told that, and they must have their own booking system, because if you're following the provincial booking system on COVAX, it doesn't give you the ability to do that, right? You can only, it doesn't open it up for you. It doesn't allow you to. The Trillium Health Partners, I think they went down an age category ahead, and so they were booking what it was 60. They were down to 55, whatever it was. But I know York has their own booking system, and Halton must have their own to enable them to do this. So safety-wise, I'm hearing 12 plus is being studied, right? And so hopefully soon, now that 18 plus by the end of the month, everyone in Ontario will be eligible for 18 plus. I think I have that date. Yes, May 24th. So after the long weekend, I think. Everyone 18 plus right across the province. And I'm very hopeful that in Peel, it may be ahead of that.
Oh, really?
I'm hopeful.
All
Well,
right.
that's what, if all our postal codes were hotspots, then yes, right?
Okay, good point. Okay.
Right? Because it's 18 plus in hotspots, and we're only 3 or 4 postal codes shy of being, um,
That's it's not like Mississauga South, right? I think. But I
it's
mean,
mostly Mississauga South. Correct.
yeah. Okay.
Correct.
So, stay-at-home order expires May 20th. Does Mississauga enter into red after May 20th?
That's a good question. We don't know the answer to that. We probably enter into gray first. So I got the new numbers. And I think what the province is waiting to do, and I think I said this last week, because when we talked about opening outdoor recreational amenities, soccer, basketball, baseball, tennis, golf, yes, all those things, I think they're waiting for a plateau. And what we're seeing now is that numbers are increasing, but at a slower rate of increase.
Yeah.
So that is very good news. But we haven't yet quite plateaued. We're not coming down. We're not declining. We're still increasing. Case numbers are still increasing, but they're increasing at a smaller rate. So that's very good news. So I just got the numbers.
Okay.
The
Great.
epidemiology report. So Peel is at 348 cases per 100,000. But there is some good news. All of our factors, the reproductive rates are under 1. All of ours, except for Khaled, which is basically 1, but they've come down a long way. Positivity rates are coming down. I remember Brampton was 22%. They're now 18.7. We're at 14. Khaled's at 13. So positivity rates are coming down. Our factors, ours and Brampton, are 0.9 and change. So that's great. We're under 1. Oh, such a relief. Our cases are 282 per 100,000. Brampton's are 456 per 100,000.
Wow. Okay. So, do you think the stay-at-home order will be extended?
There is that possibility.
Yeah.
I
Okay.
can't say no, it won't. I mean, there is a possibility. We will have been in this recent lockdown for 6 weeks, so it could go to 8. We've been in lockdown since November 23rd, but the most recent lockdown, stay-home lockdown order.
Mayor Crombie, do you know what the threshold is for gray or gray zone? I know red is 40 for 100,000, right? Is there a
Right,
threshold?
so anything over 40 would be gray.
Oh, anything over 40 would be gray. Oh, so
Right,
we're not.
right. Except that when we were at 60,
Yeah.
I was trying to make a case that we should be in red. The rules changed in red. I forgot what they all are now, because at first they could only have 10 people indoors, and then it became 50% indoors in restaurants, right? So the rules changed in red as well. But we were very close to red, and there wasn't the definition of the where does gray start, because we were clearly in between the red and the gray, but closer to the red. And certainly, as you remember, Oakville's across the street, and there were shops and restaurants open in Oakville, yet on the north side of the street was Mississauga, and our businesses were shuttered. So we were making that case, and we had a valid case then, but of course things have changed since because of the rise of the variants, the new variants.
Let me ask about the variants. Sorry, have
Yep.
we seen any of the double mutant variants in Mississauga? Do you know?
So the answer is, I can tell you definitively it is not on my list, because it
Oh,
is, what was it called?
I think it ended with 1-7. Sorry, I don't know the rest of it.
Well, it wasn't P1 though, right?
I don't think so. I'm not sure, to be honest. Sorry.
40, okay.
Maybe if you just go down the list.
Yeah, I got it here. What is Indian variant? Hang on a second, I'm going to find out. Code. But I have, they watch. They're always worried. What's she going to say? Oh no. Okay, so we have B117 is the most prevalent. Of course, that is originated in the UK, the mutation from the UK. That is most prevalent, especially in Brampton. They have over 10,000 cases there. There are almost just 900 cases in Caledon, and we have almost 7,000 cases in Mississauga. And then B1351, I believe, is South African. Very, very few, very, very few. 18 in Brampton, 2 in Khaled, and 22 in Mississauga. And then P1, I believe, is Brazilian. and 172 in Brampton, 9 in Caledon, 64 in Mississauga. So there were 36 cases of the Indian variant identified.
Okay, yeah, I remember that.
Right, but I because they're not listed on my EPI report, which they would be, I'm assuming they are not in Peel region, which is great news for us. They could be in Richmond Hill or where. Sorry.
Did you say there was
B1617? They're called.
Okay.
Not, but not. Okay.
Did they get back to you?
Yeah, of course.
Did they say that how many there were in Mississauga?
No, they gave me the number so I could identify it on the list, and it's not on the list.
Oh, okay.
B1617.
Okay. Your people are awesome.
I know. They always watch because they say we learn things.
Did you say there was 10,000 cases, open cases in Brampton?
No, since there has been. Right now there are, to find you open cases, I have to do more research. Yeah,
okay, no worries. No, I missed. Okay, so that's 10,000 cases overall.
There has been. I can tell you, where's my mayor's office? Hang on. I can tell you, oh, here, see, I found it very quickly. My people are so good. They give everything. They are. So Mississauga, we have 34,000 cases, 709. Almost 35,000. Brampton has 58,000 cases right now. Total. Wow.
Crazy. Oh, okay. So, do you have the tickets by chance? How many tickets have you given out over the last week? People like hearing.
Of course, I know what you're going to ask. I print them up.
We've been doing this pretty good.
I've been doing this. So yes, we did have. So Monday there was retail selling non-essential items. Wednesday, office employees not complying with masking regulations. Thursday, there was a large gathering in a park. Friday, a private party at a residence. And this occurred 2 Part 3 summonses. Oof, that's costly. On Saturday, again, another private gathering, 1 ticket. Private residence offering beauty services, 1 ticket. Gathering, private residence, 1 ticket. Unregistered massage, 1 ticket. So you can go to a registered massage therapist, but not unregistered, I believe is the difference here. Security highlights was just, these are the educate in the parks. Gathering at Lakeside. That was the 2 tickets noted. Credit View Woods, people playing soccer. Educated and went away. Huron Park, again, spoken to. Garnet Wood Park, educated. Sunday, Paul Coffey, they were playing cricket and they quickly left. Lakefront Promenade, playing volleyball. Again, told them, sorry, can't do that right now. Not our rules, we just enforce them. Yeah. Streetsville Memorial Park, 20 people gathered. They had to disband. Bloor Athletic Field, 10 playing cricket. They left. And Courtney Park, again, 20 people playing cricket. An additional 23 customers were educated on mask compliance on transit vehicles or transit property.
Okay.
So that's the sum total. And you and I both know that we prefer to educate, inform, and if people are cooperative, go on your way. It's only when they're not cooperative and they become belligerent that they get ticketed.
True. Dr. Lowe last week mentioned he started the new policy that if you had 5 COVID cases within the last 10 days, you're closed for 10 days. Has that helped at all with with workplace outbreaks?
So, well, sure, it helps because of course we shut down the line. They in businesses. Hang on, that's one I didn't print. So it's on the dashboard, right? It's on the dashboard. Yeah. There had been 11 last time I checked that had been closed down. Only, I think 10 of them were partially closed, 1 of them completely. And it allows the shift to go home and it allows all the cleaning to be done and review of protocol guidelines, health guidelines, labor guidelines, etc. And it gives, public health an opportunity to go in and do refresh on, are you following protocols? Let's, go through them all. I think there was a Mississauga car dealership that did get closed down, as I recall. They were on the dashboard listed, as well as the ones we're aware of, right? Oh, they're checking. Oh, I got them. Look at this. They are good. There was a cleaners I
Yeah.
won't name them. They're on the
Yeah.
dashboard. A packaging
Yeah.
company, textile, fabric dryers, finishers. Oh, FedEx, but that was partial, so probably a line of Giraffe Foods. Here, I'll try not to name them.
Fast food place in Brampton that closed too.
TJMX. Yeah, I'm only looking at Mississauga. TJMX
Yeah.
Distribution Center, Amazon Fulfillment, Pumps and Engine Place, Candle, WG Pro Manufacturing, Canada Post, of course, Canadian Tire Distribution Center. That's one in Brampton. Kinetsu, 24 in Peel. Oh, there are some more. 24 in Peel. Can Art Aluminum, Apple Car Company, and Amgem, partial Amazon Fulfillment, the other location, and the 2 locations. 8 in Mississauga. 8 in Mississauga. Of the 24, 8 are in Mississauga.
Okay.
And it sounds like very few are complete closure. They're just partial. One line there were 5 linked cases on a shift or on a line, and that was closed.
Okay. I know today's not the best day, but have you heard anything from the province in regards to opening basketball courts, tennis courts,
You know,
golf?
I wish. Oh, breaks my heart too. So I really think they're going to wait for some good news for the trend line to start going down, and then announce them. You know, and they all feel, and I know Dr. Lowe feels as well. He doesn't oppose it. I mean, he wouldn't put a Section 22 in, but at the same time, he said it just doesn't send the right message when case counts are soaring and, you know, ICUs are full. And the only way our hospitals are surviving is that they're transferring patients out, and they're doing so like 40 on a weekend. There have been like 900 patients transferred in the past few months in Brampton at William Osler, and over 500 in Mississauga at Trillium Health Partners. So we're only staying afloat by transferring patients. So he said, you know, while the hospitals aren't stable and cases are increasing and the cases are very severe, the ICUs are full and they're full of younger people, it does send the wrong message, even though he agrees, you know, the risk of transmission is very low. Just further openings in a lockdown. Not yet. Let's wait till we're hearing better news and we're start to trend downwards.
Cool. Do you support vaccine passports, or would you?
You know, I think that eventually we're going to see that. You know, we're going to say, you know, I can indoor dine. I've been vaccinated. We all have. Or to book a flight on an airplane to travel. We've been vaccinated. I think it's going to be problematic for people who, by choice, decide they don't want to be vaccinated. I think they will have a tougher time in the future. I do. I mean, you know, I'm not going to. We won't be initiating that here in Mississauga. That would come at a, you know, Public Health Canada probably that would do something like that if they were going to do it. But you know, there will be. How could there not? I'm going to the restaurant. We've all been vaccinated. We're traveling. We've all been vaccinated.
True.
You can see open to people who have been vaccinated. It's going to set up a 2-tier system. Is it right? No. People should have the choice to be or not to be vaccinated. I agree with that. But eventually, people will feel safer to be among people who have been vaccinated.
True. You're going to see anti-vaxxers. All you have to do is say, you can't go to Cuba, and they'll be like, give me a vaccine. So.
I don't know. There are still groups that are still organizing those kinds of rallies. Anti-vax, anti-mask, open business.
Yeah.
You know, but for the most part, people are very reasonable. They want us to get through this. They want to protect everyone and do it safely. You know, and if these are the measures we have to impose so that everyone can be safe and people aren't being hospitalized and intubated and worse, losing their life because of a virus, then these are the measures we have to take.
True. Let's talk about school. A lot of parents watch this show, and do you think? I think Minister Lecce said today they might not go back this year, but do you think they'll go back to school in September?
Yes, I do.
Definitely.
I do. I think there'll be mass vaccination, herd vaccination by, I guess it's called herd immunity, by the end of the summer. I think that is very likely that they will go. I'm sort of surprised that we're still not holding hope to have a session in June and July, but that's not my decision, that's theirs. So if Minister Lecce says probably not this year, then I think by September, because, you know, we're going to be vaccinating 18 plus by the end of May. I had some statistics, see if I can find them, from Dr. Lowe. Aha, here they are. That was good. There will be 37% covered 18 plus by the end of April. No, by the end of May. By the end of May, excuse me. And 71% covered. 37% covered 18 plus, and 70% covered 65 to 79.
Okay. So one of the questions I had here, it's don't we have to vaccinate kids before we bring kids back to school? Like, it's a good point. What do you think?
I don't know if children are eligible for all the vaccines. I think that's something that's still being studied. I think they're willing to go 16 plus, and now I've been hearing 12 plus. I'm not hearing 6 plus or younger. That is still being studied. So, I mean, the good news is everybody else has been vaccinated. So even if they were big carriers in the first and second wave. I've only heard a few cases of young children being very sick of the third wave. And it's only been the new variants that have affected very young children. I don't have the numbers here with me. There have been cases, but not very many, but nonetheless, there have been a few. And of course, we did have one 13-year-old, Emily Viegas, that passed away in Peel, Brampton resident. And that was the youngest person who lost their life as a result of this virus here in Ontario. I think there was somebody younger out west, but here in Ontario, Emily was the youngest.
Wow. So I'm going to ask you one non-COVID question here. There was a the chickens. Okay, there was a very tense discussion about backyard hens at the last week's general committee meeting.
Right.
Where do you stand on the hens issue?
So the problem with hens, we haven't voted on it, and it is coming back for further discussion, I think. But hens attract other rodents, and then wildlife. So when you have hens, you also, so I'm told, and so it's been studied, are rats and coyotes. It's kind of the circle of life, right? So people are very wary of that. So we had some really mixed comments on hens. There were some that favored it and others that didn't favor it. It was sent back, but it did not receive majority support to proceed in any way. I think we sent it back and asked for some more information, but the vast majority of council right now does not support it.
Okay. Have you ever had hens in your backyard? Ever?
Well, my dad grew up on a farm, so I used to, as a child, go to the farm, but I mean, the farm was between Merrickville and Kemptville, out, in south of Ottawa in eastern Ontario. So it was legitimately an operating farm.
Yes, true.
cows and pigs too. But we did have a chicken coop. I got locked into it once. That was fun. I was very young and locked in the chicken coop.
Tell us that story afterwards in another
episode.
Yeah. So, Mayor Crombie, thank you so much for being here for over 14 months now. Thank you.
My pleasure. Thank you. Thank you, Khaled.
Take care. Bye.